Right.
The good summer tunes, man.
Yep. It's a good road trip song. Going on a summer road trip.
Windows down.
Air flying 80s hair band rock.
We have to get wigs by this point.
Yep. All right. Welcome, everybody. Welcome back to the MedTech Jam Session with Chris and Mike D. Chris, how are you, buddy?
Hey, good to see you, bro. It's going to be good.
It's good to see you, man. I love doing these. These are so much fun.
Yes, they are.
Well, we're in the summer season, and we've got a lot of great content coming up. We've got a lot of great interviews with some great founders, CEOs, and leaders, some pretty cool startups. So if you're looking to add a podcast to your library, this is the one, because as we start getting to know these leaders, you're going to learn a lot from their successes, their failures. These are the men and women in the arena, and that's why we love to interview them. So
yeah, we see definitely through all of these that we've done that we've set a bar here. We've set a bar relative to true leadership, true either past success or future success to come, and technologies that are going to really have a lot of influence on the years ahead. And I think that's the most important thing, is giving airtime to all of those, because it is critical that people become aware sooner than later, especially investors.
Yeah. Well said. Before we bring on our guest, Sujit Duke from Gyder Surgical, really interesting company, interesting technology, and it could be some really good timing for them and for the market. So we're interested in hearing more about them. We have a couple of housekeeping things, a couple of big announcements. The first big announcement is with Convey Med, there's going to be a big announcement coming soon. And that's all I'm going to say about that.
Is it capital BIG?
It's huge. It's huge. That's the big announcement, is that there's a big announcement coming.
So be watching.
So be watching and be listening. Secondly, I'm really excited. Chris and I are going to start we're going to pivot a little bit from doing founder interviews to running a podcast series on the whole concept of go-to-market in medtech. We're going to interview experts, leaders, founders to talk about going from, okay, we've got our FDA approval. What do we do now?
Yep.
From doing a limited market release, selecting your KOLs.
Yep.
Picking a path on distribution, direct, indirect. How do I build a sales process?
What's healthy for the business and what's not in that process.
Right.
And all these considerations that at the time of inception of the company should really be considered. It should really be planned as part of the overall strategy and not an afterthought. It cannot be, it should never be looked at as a serial thought process. It's got to be parallel.
Yeah. And you probably need to be thinking about this sooner than you think.
Yes.
Yes. So much of it is based on street level execution. And we're going to get into it. It's going to be very practical, very tactical, and hopefully very helpful. I'm looking forward to it because I think we're all going to learn a lot. I know I will.
Yeah.
So anyway, stay tuned for that later in the summer. But today we've got a great interview. I'm excited to bring on our guest today, Sujit from Gyder Surgical. There he is. Look at that. You ever get a round of applause like that, Sujit?
Awesome. This is really exciting. Feels like I'm at the FIFA World Cup game.
This is the World Cup of MedTech podcasts. Thanks for that positioning. I love that.
Yeah.
Love it.
Yeah. Well, thank you for having me guys on the podcast.
Absolutely, man. Happy to have you.
Yeah, great to have you. So Sujit, we got to know each other a little over a year ago. I learned about your company and what you're building. Tell us a little bit about the history of the company, how it was founded, a little bit about the founding team, and kind of how you were brought in most recently, and just give us a little bit of context and background into what you're building, Sujit.
Yeah, absolutely. So just for the listeners, my name is Sujit Dike. I'm the CEO of Gyder Surgical. Gyder Surgical is an Australian company. Interestingly, the founder is an Australian individual who has been in the orthopedic space, and his name is Bob Lai. And he runs his own custom surgical instruments company. He was talking to a hip surgeon, and the hip surgeon was talking about the challenge of placing the acetabular cup, the prosthesis, correctly at the right angles every single time in the hip socket. And Bob, being a former airline navigation engineer, immediately thought about, oh, this is like landing a plane correctly, safely on the runway every single time. And so he thought about miniaturizing airline navigation technology and applying this in this space, right? And so this is an interesting example of how innovation sometimes comes in from outside, right, and makes a difference. And so Bob came up with a concept, and then he realized that there's a lot more that needs to be put in to make this a reality. And so the company was formed, Gyder Surgical was formed, and Bill Hill was hired. He was the chief head of R&D and led the company for a few years in developing the technology in partnership with engineering services providers, particularly in Australia. So that's how the company started. And we just went commercial in the US. So we'll talk a little more about that shortly. But interestingly, my background, so I'm an engineer by training. I've really meandered my way into medtech. I was in part of the Human Genome Project. I was writing code, assembling genomes of different organisms. I worked in a company called Affymetrix, which was the first company to pioneer gene sequencing, commercialize gene sequencing, and really bumped into medtech through business school when somebody from Synthes approached me. And Synthes was a market leader in orthopedic trauma. So I joined Synthes as a product manager in spine orthopedics and worked in spine and trauma. We got acquired by J&J. I had different commercial and strategic roles in J&J, and including leading their ASC and enabling technologies group, building and leading their account management team, calling upon the largest health systems, the national accounts, the GPOs across the entire medtech sector. And I left J&J in 2020 and really wanted to go back to the West Coast and be in the startup world. And I was working in another startup in the exoskeleton space. It's very different from medtech, but a very interesting space, when I was approached by one of the board members at Gyder Surgical, Nicholas Pachuda, who's a former surgeon, has been in the orthopedic space for quite some time. And he said, like, there's a very interesting Australian technology. You want to have a look at it. They wanted a US-based CEO with commercial experience in the US. And so that's how I got introduced into Gyder. And it's a long story, but basically at the end of the day, whenever you are taking on a new role, you're looking at the team. So clearly one of the things I looked at was a board membership and the team itself. And I found like this is a team of people that I would like to work with. And so that's number one. Number two, and as you guys know, you've been in the space in medtech for a long time, whatever problem you're trying to solve, in this case, we are improving surgical accuracy for hip replacement as our initial product. That's table stakes, right? You got to be able to do that. But what really drives adoption is what I call 4 factors, right? Is it easy to use? And the answer is yes for Gyder, and I'll explain that in a minute. Is it fast, or does it slow the surgeon down? The answer is we are very fast compared to every other technology in the space. Does the surgeon or the staff have to make a lot of changes to the workflow? The answer is no for Gyder. It seamlessly integrates into their existing workflow. And the fourth is, can it be cost effective and can you make money? Basic fundamental business, can you make money off the technology? And the answer is absolutely yes. And so those 4 factors were very clear to me right from the beginning. And that's how I got into Gyder 4 years ago. Since then, we completed the development of the technology. We got FDA clearance, and now we are commercial in the US.
That's great. So I'm curious, you spent some time talking about the problem that you're trying to solve, which is component positioning and total hip replacement. A lot of technologies out there are trying to solve that problem. How are you guys doing it uniquely? What sets you apart?
Yeah, so if you look at current standard of care, Mike, vast majority of surgeons, interestingly and surprisingly, even in this day and age, are using either freehanding the cup placement. So they basically are relying on their surgical experience, years of experience, placing the cup in, or they are relying on intraoperative fluoro. So everybody has to wear lead, everybody has to bring in C-arms, take shots. And now that you can imagine, there's a lot of resistance to that, right? It slows down the surgery, it's cumbersome. And interestingly, there's a lot of data coming out recently, including a Japanese paper, a publication this year, which shows that exposure to long-term ionizing radiation, even though each individual dose is safe, considered safe, has led to increased risk and prevalence of cancer. So, for example,
Mhm.
female orthopedic surgeons have a higher risk and odds
Mhm.
ratio of getting breast cancer compared to non-operating female physicians and control population, right?
Mhm.
Yeah.
And so that's one of the challenges. So that's the standard of care. And the second piece is you have all these navigation and robotic technologies that are large format robots. There are traditional navigations systems. They all use a combination of imaging, let's say preoperative CT, intraoperative fluoro, or optical cameras and whatnot. And all of them use metallic pins that
Mhm.
are inserted into the human pelvis. And depending on the technology, you attach arrays or cameras and whatnot. Those pins can lead to local infection. Oftentimes, if you look at the FDA's MOD database, you will see the reports of pins breaking and the distal end of the pins remaining in the patient's bone, right?
Mm.
So there's a lot of pain, there's local fracture and all that, which is why a lot of surgeons really don't like using pins. And on
Mhm.
top of that, it adds a lot of time. So Gyder is unique in the sense that it's the only technology in the market that is both pinless, so no pins at all used in the procedure, and imageless, so no preoperative or intraoperative imaging required for use of the technology. So the way it works is it uses a metallic orthopedic brace that is temporarily placed on the patient to capture the anterior pelvic plane or the 3 points anatomical landmarks that are used by every other technology. So it's a standard process. And then there's a handheld navigation unit, computer unit that captures that plane. And that same unit is then attached to the impactor, which is the standard instrument to insert the cup in. It's also the only technology it provides real time information on cup angles while you're impacting the cup in. No other
Hmm.
technology provides that, right? Every other technology, either you have to pause and bring in the C-arm, take shots, or you have to take off the sensor. This is the only technology that provides real-time guidance during cup impaction. So it's a very simple to use product, and it's very fast. We barely take a minute, less than a minute for registration, and so we have really made this system extremely efficient and fast for particularly for high volume surgeons.
Mhm. That's great. That is excellent.
Hi, everybody. Mike Donahue here. As a medtech leader, you know how important it is to hit the ground running when your new product clears FDA. You need to quickly align and equip your field sales team with training, customer targeting, sales assets, and operational resources that will maximize revenue and traction. Well, at Convey Med, we have the app for that. Convey Connect is the mobile-first launch operating system that ensures your field team is clinically confident, culturally aligned, and operationally efficient from day one. With your customized white-labeled Convey Connect app, your reps can train on the go, access agentic AI to identify ideal customer targets, query AI agents to provide intelligent answers to clinical and technical questions from your customers, communicate and engage with both company leadership as well as your teammates in the field, and then just so much more. So if you are interested in learning more about Convey Connect, go to our website, conveymed.io, where you can book a demo and we'd be happy to take you through the app. And now back to the show.
I'll tell you, it's a big problem that you're solving relative to the pinless, imageless. I mean, there's a lot of things out there that have already gone pinless, but the imageless portion is definitely something that's very intriguing. In your experience, and I know you guys are in limited launch, and I think that's fair to share, but in your experience with surgeons, whether it be guys that you've run this by already or present users or whatever the case is, what was their aha moment when they saw your technology?
Yeah, it's interesting. So we actually have felt two aha moments in our process, right? When we engage with surgeons. One is when you're physically demonstrating the product to the surgeon. Most surgeons, their immediate response is, man, this is fast. And you don't need to sell me how fast this is, right? Every other
Mhm.
technology, you got to sell me on it's how cumbersome and will it slow me down. So for them, like speed is extremely appealing. As you know, these
Mm-hmm.
days, high volume surgeons are doing 6 to 12 cases a day, and they're
Mm-hmm.
taking like 30 to 40 minutes per case. And so if you slow them down, like most competitive technologies are adding double digit minutes, including robotics. That's a significant addition in slowing me down, right? So this is why a lot of high volume surgeons are looking for more efficient technologies, and so that's the big aha moment. And then when they're operating, they and the staff really appreciate how little disruption or how little change it has to their existing workflow. It just is very easy to integrate, right? So for example, just to illustrate, we've been able to train the staff and the surgeon in less than 2 hours on site without cadaver labs, without sawbones, whatnot. And they're up and running using the product the next day. Right? And so that just tells you how easy it is to adopt. And then we often get comments from particularly the operating room staff, right, who do a lot of the work, right, and setup and all that. They're like, oh, okay, this is actually very easy. I can do this, and it's not a lot of extra work. And so it's important for surgeons to see that their staff is also benefiting when you're adding a new technology. And so for them, that's important. Now, in every case, we have done cases with 7 surgeons in India, Australia, and the US to date. And in every case, the surgeon has gone back and checked what Gyder reported in terms of the cup angles versus their own standard image-based software, and they have confirmed the accuracy, right? So they like the fact that this is accurate. And it's interestingly, we have clinical studies on cadavers, but now we are collecting more information. The accuracy is similar to what you see with other systems. So for them, that's the other aha moment, which is like, okay, if I can get very similar accuracy with such a simple system, why do I need to use more complex?
Totally. And the fact that you have to be delivering to them an ROI they could never experience otherwise.
Yeah, exactly. Now, one of the interesting insights, and to be very transparent, I personally did not appreciate this when we were launching and when we were developing this product to the extent that this will be appealing, is you do have a lot of surgeons. It's a massive market of surgeons who are now increasingly sensitive to use of fluoro, right? So they want to really eliminate or minimize fluoro. And so that's very appealing, right? So the pinless attracts them. Initially, that attracts their interest, but it's really the fact that this can really eliminate fluoro and give them the confidence that they're placing the cup and peace of mind when they're placing the cup accurately is something that I'm finding that that's a massive market that, to your point, Chris, is really not served by most other existing competitive technologies.
Sujit, is the technology for your hip product, is it approach agnostic? In other words, can you do a direct anterior or anterior lateral posterior approach? Is it a focus on one or more of those approaches? That was my first question.
Yeah, no, that's a great question. So our first indication that is approved and in the market is for the anterior approach. And as 60% now, according to AAOS and AUKUS, is now anterior and is growing rapidly, much faster than posterior. And the rest of the world is also catching up, particularly in Japan and part of Australia. But we also have a posterior in development, and we anticipate that will be coming out of the market in the future.
So the reason I asked that question is for those who are doing the anterior approach, do they become dependent on the fluoro? And now you're saying you don't need the fluoro.
Yeah.
Are they like, are you sure? I kind of like having the confidence that after I take a shot that it's where I think it's supposed to be. How do they get over that trust issue? Like now I don't have to take a fluoro shot.
Yeah, it's a great question, Mike. And you're spot on. There's a lot of literature out there that shows that anterior surgeons are using far more fluoro than posterior surgeons, right? For a variety of reasons, including access to surgical site. And the other thing is you also see increased use of fluoro by younger surgeons, right? Not surprising, like they want that confidence. And also those surgeons who are switching from posterior to anterior, right? A lot of surgeons who are switching gears. And so you see that increased fluoro. And what we are finding is, so for example, we have seen this now with multiple surgeons, right? You got to build confidence over a period of time, right? So what they do in the beginning when they start using the Gyder system is they are going back and checking using either shear arm shots or post-operatively they're checking, right? Cup angles. And once you get that level of 15, 20 cases, right, you need to go through that phase of building confidence we've seen now that comments are coming back to say, actually, I don't need to use fluoride at all. One of our first users in the US, particularly, is Dr. Paul Lombardi, who has done cases at his ASC as well as now at Morristown Medical Center. And interestingly, he was not using fluoro during the procedure at all. He just took a final shot, which I think they will still need to take final shots just for record keeping. But otherwise, for the procedure, we can reduce or eliminate use of fluoro.
So and just thinking through this, with the technologies that are out there, do you have a lot of confidence in your ability to be protective with your IP relative to the stuff that's been out there and or has already come off patent? Because, man, we've been playing in this navigation world now since about 1992, something like that.
Yeah, this is obviously going to be a very competitive market and will remain so, right? And medtech is brutally competitive when it comes to IP. We have 3 patent families and that are already granted in all major markets, and there's a 4th one that the first in that series just got granted in Japan, and we are in late stage advanced review with Europe and US, and we are pretty confident we'll get those claims. And that IP covers different aspects of the technology. And I would say that the strategy is always a combination of making sure you're protected on IP, but you cannot just rely on that, right? There's a lot of proprietary stuff that you want to bring into the table, plus execution, right? That really sets the age. I mean, I spent a lot of years in Synthes, screws and plates, and they were highly successful. And well, those are very difficult to protect from an IP perspective. One of the biggest learnings was it's always a combination of all those factors. But Chris, to your point, we do have pretty good protection, and we continuously are reviewing our IP. As we know, competitors are responding, and we're certainly reviewing our IP and continuously looking at ways to update and keep it fresh.
Great.
I love that it's a tech transfer of technology from another industry. I think there are probably other sources of novel solutions out there that in our space that we're not even considering.
We missed the most obvious.
Hiding in plain sight. Yeah.
We've been doing this too long.
Absolutely. And I have to give credit to our engineering team, engineering factors, including the gentleman who came up with the concept on really focusing on ease of use and workflow, which is from a human factors perspective. And a lot of that also, I think, came in from the fact that some of these individuals were from outside the industry, right? And so you bring in fresh perspective in ways that you probably may not, because otherwise you're always constantly thinking within the same box if you were from the industry. So it's a pretty healthy mix of experienced people and people from outside the industry who have developed this product. And so kudos to them.
Yeah, that's well said. A healthy mix. That's very well said. I think we chatted on before we started about the difference between sort of open source and closed. Is your system dependent or connected directly to any one implant system, or is it implant agnostic? Kind of how are you guys thinking about that now, and then thinking 6 months, 12 months, 24 months down the road?
Yeah, it's a great question. We are implant agnostic, so the system can work with most marketed cups out there in the market. And we have deliberately taken that approach, Mike, to start with, because we believe we want to eliminate any barrier to adoption and make it as easy as possible for surgeons as well as hospital systems to adopt our system. Right. And because of that, a lot of surgeons are liking that, right? Because they're not changing the practice, they're not changing their implant. There are a lot of things you will have to do if you make it a closed system. And given the stage where we are, and we believe that's the best approach, right? Because our goal, frankly, is to demonstrate wide usage, right? And repeat usage with different surgeons, right? In different hands, different markets. And so for that purpose, this helps a lot. The other advantage is, you will see this, you often see this in the space. So for example, we have had one surgeon who started with one implant, switched to another implant, came back to a third implant. And some of that was dynamic, potentially about him looking at alternative implants, right? And maybe switching implant manufacturers. And we caught him in that in that transition, but our ability to respond while he was, and also it's a function of different hospitals, right? And what contracts and what he uses in one system versus his ASC and all that stuff, right? And so our ability to respond to his needs, to surgeon needs, without them worrying about, oh, I got to use only this implant, helps a lot in the beginning. Now, having said that, we do have multiple pathways to make it a closed system in the future if needed. So certainly that's an element that we have in mind. And it's really a function of how do we best serve the maximum number of surgeons and patients using this technology.
Well, to that point too, it's great, right, to stay open, in my opinion, and waiting for the eventual partnership, and they can choose to do what they want to do. I think that something that comes to mind is the revenue model as it relates to what you guys, and I know it's early, I know you're commercial, and I get it, but it's early, and that's very smart. You're not overextending, but you're proving success. What is that revenue model, if you can share? And you don't have to get into detail, but just high level structure.
Yeah, absolutely. Look, and before I respond to that question, the other advantage of having an open system at this early stage of commercialization is our go-to-market model is a hybrid sales model, right? So we are relying on distributors, third-party distributors who already carry implants, right? And our goal is to find the right partners locally for regionally and scale that way, while we, as you said, right, we wait for an eventual partnership. And this kind of flexibility makes it easier for us to have the right partners in different markets rather than have only one kind of partner or one implant manufacturer, because you also know that salespeople will tend to go to their surgeons and all that, right? So this gives us a pretty good wide variety of access to surgeons who are using different implants, and is providing visibility to, frankly, different strategics as their surgeons are using this technology. And interestingly, all of these strategics have existing platforms as robotics and everything, but they're seeing a lot of their high volume surgeons are using our technology or likely to use our technology. That's a very important data point going into potential partnerships in the future. So coming back to your question about the pricing and the business model, look, there are different flavors, certainly, and it's market dependent, but I'll give you two different flavors. One is in the US, I would say, in general, we are looking to consign the capital, which is all reusable, including computer navigation system. And then we have a per procedure cost for the use of the software, which is also like, let's say, per click, per procedure, and the consumable, right? And we're trying to keep it simple, Chris, in the beginning, especially because we don't want ourselves to be locked down in capital purchase committee decisions and all that, right? As I said, right, our goal is to drive and demonstrate clinical adoption in this phase of the cycle. And so for us, we are minimizing that. Now, we do envision in the future other variations to this model where you could go into subscription-based models or other creative financing. But I've also found, and as I said, like I've led account management teams for years when I was in J&J. For me, one of the biggest takeaways is how do we make it simple for the customer? And really don't complicate things if you can avoid, right? And that's one of the things we are trying to go for. Having said that, what you see on the other end, let's say if you take India as an example, as a market, and we see a lot of potential for this technology outside the US too, because of the simplicity and lack of requirement for imaging, right? The infrastructure requirements are far less. We've seen, like, for example, a lot of hospitals would prefer to purchase the capital equipment and they're willing to pay, let's say, a significant amount for that, but they want a lower variable cost. And we can do that. And the reason why we can do that is really, and I really want to emphasize, we have a massive design-driven, low cost of goods advantage. And why is that? Because we have eliminated a lot of the hardware that goes into other competitive systems, right? So we have eliminated pins, we have eliminated imaging, big box stuff, and all that, right? So our costs can be low, so we can price competitive, be flexible depending on what the customer wants, and still have appropriate industry-leading unit economics.
That's really important. So your decision to stay open, and then your revenue model, has dictated your choice to do a hybrid channel, right? Your distributor slash combination. Speak a little bit more about that. I'm curious what you mean by a hybrid channel. It sounds like you're going to leverage distributors, but when you say hybrid, share a little bit more about that.
Yeah. So the way we look at it is we have a Gyder, and we're building this team, but we have a Gyder team of clinical market development specialists, right? So their function is about clinical selling, training, providing initial case coverage, right? Every time a new surgeon is onboarded, and really supporting distributors. And then we see your traditional orthopedic distributors, right, who typically are focused on then the clinical support in the OR, the logistics of the product in the hospital or ASC. And then it's really a function of having a supporting function on the Gyder side for negotiating contracts, right? And it's really, when I say a function of also what kind of distributor do we have in that region, right? You will see a lot of variation, as you can imagine, in the distributorships and their abilities or the resources to, let's say, walk into an HCA versus walk into ASC and have a contract negotiation discussion, right? So there are certain functions we are keeping in Gyder, supporting distributors, and then the real clinical sales and scale function and capability is through distributors. And we found that, and this is not a novel approach, right? This has been demonstrated in the industry by other players also relevant to our market. And what it allows us to do is really keep our resources flexible and be less capital intensive, right? And manage our cash burn rate. And that way, as we scale, we can calibrate our responses depending on market needs and conditions.
That's great. That's great. Is there, especially with the handheld device, right? And of course, everybody's these days is like, where's the data component to what your technology is and the AI element of it?
Yeah.
Give me a little bit of insight into that.
Yeah, it's a great question. And look, data and AI are going to be playing a central and increasingly important role, right? There's no doubt about it. The way we think about this, and particularly my philosophy, is never lead with technology, lead with the problem you're trying to solve, right? And find the best tool you can find to solve that problem, right? And that's one, I would say, pitfall we are trying to avoid is just trying to put in AI and connectivity where it's not needed, right? And so the way I look at it is our first goal is to put as many systems as possible in the hands of surgeons in as many hospitals, because that's what allows us to collect data.
Yes.
Right. And then that creates that second order cycle of driving insights and improving outcomes, right? And the other, and so you will see generations and iterations of our technology evolving, right? Exactly, and to follow that philosophy. But what we are trying to avoid is also getting bogged down talking with CISO and the IT department of hospitals.
Oh, yeah.
You're familiar with the hacking incident earlier this year.
Oh, yeah.
There is super sensitivity to any cybersecurity risks. And so part of our design for the first generation is a very closed system that really minimizes or eliminates any cybersecurity risk. And again, our goal is to get this in the hand of surgeon, prove this clinically first and adoption wise before we start adding layers and complexity to it, right?
Great.
Yeah. I will say one of the interesting developments that's happening in the space is when you look at upstream of our device, right? So we think about our device as a delivery vehicle. There's a lot of preoperative planning that goes into any case, right? That's where you're seeing a lot of AI-driven preoperative planning that speeds up the process and everything. And consistent with our theme of being implant agnostic, we are also agnostic to the preoperative planning philosophy or technology that a hospital or a surgeon or an ASC is using, right? But we can integrate information from that into our device in our next generation device. And that way we are sort of, again, providing maximum flexibility to surgeons to use this device.
That was one of those sort of hiding in plain sight moments too, when the idea of the shifting in the acetabular position relative to the change in the pelvic tilt was like a big aha moment. And I'm like, it was been sitting there right in front of us for
ever
a billion years.
Yeah.
It's fascinating. So, Sujit, I know you're raising some money. You're out there beating the bushes. Tell us about how that's going. And are you having a ball just asking people for money? Isn't that fun?
Fundraising, yes. It's like if you like doing deals, right? The thrill of having a contract done, having a surgeon adopt your technology, it's that kick when you get your investor who's saying yes, right? It's the same thing, but it's like that up and down. It's massively energy draining if you're not managing your energy, right? But look, I'm having fun. We are raising a Series A. We are raising 6 million Australian dollars, which is roughly about 4.2 in US dollars. We already have two existing investors leading the round, and we have 60% of the round committed. And we are in discussions with other investors, but certainly looking to close a gap. And this round will fund primarily US commercialization. We are also TGA approved, but we are focusing our capital and energy on the US market primarily. And then we are having conversations on potential strategic partnerships to commercialize in Australia. But that will be the focus, and also continue to build post-market evidence to drive support a broader clinical adoption. I would say that we've been extremely capital efficient to date, if I may make a plug on behalf of Gyder. So
Absolutely.
till date, we have raised about $8.5 million US dollars prior to this round. That includes more than $1 million in non-dilutive funding from the Australian government. And with that, we have gotten approvals in two major markets, right? FDA 510K clearance, and Australia TG approval. We have started commercialization in the US, and we put the device in the hands of 7 different surgeons in 3 different markets, and demonstrated that this technology can be adopted on a wide variety of environments and market conditions. And we've also demonstrated clinical accuracy through clinical studies, right? And so we continue to be very capital efficient, and this 6 million in Australian, or let's say 4.5, will enable us to hit some critical milestones that we believe will position us for much broader strategic partnership or other activities.
That's great.
That's great. Well, congratulations on the progress you've made. Being capital efficient, I think that's a necessity these days, isn't it?
It is so critical.
Yeah, absolutely.
You have no option. I mean, it's not like you can be capital inefficient, because the capital's not there to be inefficient with. So
yeah, absolutely. Especially in medtech, especially in orthopedics these days, right? Like right now, as all the capital is flowing in a certain direction in certain themes. But I would also say one of the best advices I've gotten, and one of the biggest learnings for me personally, just like any other startup, we've gone through those near-death experiences, right? Like in different stages. And what I would say is minimizing your cash burn has been absolutely key for us still being around and making progress. And so for me, that is front and center. Although it's painful, I would like to spend more money and hire more people and go crazy, but we got to manage, and we got to manage to milestones in an efficient way.
Yeah. Well, Sujit, whether if you're a surgeon or you're a potential investor or a strategic, anybody interested in learning more, where would you like for them to go find you or learn more about the company?
Yeah, so certainly there are multiple ways. One is certainly I can be approached via LinkedIn. You can search up. It's a very unique name. There's probably just only one individual on LinkedIn with my name, Sujit Dike, Dike. But you can also reach Gyder with my first name at gydersurgical.com. Or also, if you go to our website, there's contact information on our website. Awesome. So 3 different ways you can approach me.
Great.
Excellent.
Congratulations on making it this far.
Yeah, no, thank you. And thank you for the opportunity and sharing our story.
Yeah, absolutely. You bet. You bet. This was great.
Thank you.
Well, that's going to be a wrap for another episode of the World Cup of MedTech podcast, the MedTech Jam session with Chris and Mike D. Appreciate you guys hanging out with us, and we will see you on the other side.